Lately, there's a clinical pattern that I see frequently. A patient on TRT presents with subtle issues such as fatigue that doesn't resolve, or an increase in irritability, poor gym recovery, or a vague sense that their health isn't keeping up with their labs. And their testosterone levels look pretty good, but the bigger picture kind of feels off. That's often not about the dose as much as it is about the whole person. And one compound I always revisit in this case is always NAC. While they're not crashing, spiraling, but they're not thriving either. Subtle shifts in fatigue or mild irritability, or that vague sense that the gears aren't running as smooth, the issue isn't always testosterone itself. It's how the body is metabolizing and managing that new hormonal environment, and this is where NAC earns its place. In this video, I'm breaking down how NAC supports the body's detoxification system, facilitates hormone metabolism, and helps maintain physiological resilience, especially in patients that are on TRT or anabolic compounds. I've used NAC clinically for years, and by the end of this video, you'll know exactly how it fits into a hormone protocol, how to dose it effectively, and why it's not a magic pill, but a key ally. NAC, N-acetylcysteine, is not your average over-the-counter antioxidant. It's a biochemical powerhouse. As a precursor to glutathione, it helps your body manage oxidative stress at the foundational level. And beyond that, it plays a role in detoxification, mitochondrial support, and even neurotransmitter balance. Its delivery is cysteine, which is an amino acid that your body uses to fuel phase 2 liver detox, specifically through glutathione conjugation. When someone is on hormone therapy, it is critical to support the body's ability to clear hormones efficiently, as they're metabolized in the liver. NAC gives your liver the fuel to do exactly that, and it works best with support. So stacking it with vitamin C to stabilize it, selenium to drive glutathione peroxidase, as well as glycine, which completes the glutathione triad. This synergy is being studied and has shown promise in reversing functional glutathione deficiencies, as well as improving insulin sensitivity and boosting more of the mitochondrial energy. When a patient goes on TRT, hormone levels begin to rise, but metabolism must keep up. The liver doesn't just break down hormones, it modifies and neutralizes them through multiple complex processes. NAC facilitates the detox pathways by elevating intracellular glutathione. That means smoother breakdown of testosterone and estrogen metabolites, reducing oxidative load on the liver, and influencing a better hormone balance downstream. In my clinical work, I've seen patients on testosterone develop symptoms like estrogen dominance, where they have bloating, irritability, even gynecomastia. Not because they're overdosed, but also exploring the possibilities that it could be because of their clearance pathways could be more sluggish. This is where it's also important to remember that each patient has different sensitivity to estrogen and androgen fluctuations, and sluggish metabolism can magnify those effects. NAC doesn't block hormones, it helps the body manage and process them more efficiently. It supports the internal environment needed for hormone therapy to work better. Think of it less as an intervention and more of a foundational pillar in optimizing metabolism and detox capacity. I was once asked, can NAC reduce the effects of TRT, such as erythrocytosis? Now, this is a big question I get in the clinical hormone practice, and androgen-induced erythrocytosis is one of the most common side effects of TRT, especially when dosing is excessive or when certain compounds like nandrolone are in the mix. But what's driving this process isn't just the testosterone, it's the oxidative stress, inflammation, and amplified erythropoietin signaling that comes with it. NAC is not a drug that lowers hematocrit. Instead, it supports antioxidant pathways that can influence the upstream contributors that elevate hematocrit, such as oxidative stress, inflammation, and dysregulated erythropoietin signaling. Essentially, your body needs more oxygen, especially in the context of androgen use. When the body is under oxidative strain, it signals for the body to make more red blood cells in an attempt to carry more oxygen. This is often over-amplified in the context of high androgen exposure. You add in poor mitochondrial function or inadequate detoxification. NAC does not fix this directly, but it supports the underlying systems that manage redox stress and cytokine activity. It helps essentially the terrain, not so much the numbers. So if someone's experiencing early signs of androgen-induced erythrocytosis, and especially if they're also inflamed, NAC may help lower the burden. But again, it's part of a much larger picture that includes dosing strategy, inflammatory resolution, hydration, and sometimes pharmacological intervention. NAC supports physiology. That's its power. NAC has a short half-life, which means you'll get better coverage with 2 to 3 divided doses per day. For more hormone-related cases, 1200 to 800 milligram daily works very well. For more of the neuroinflammatory or detox-heavy cases, you can scale up to 3600 milligrams in divided doses. And to amplify the effects, you don't want to forget the stack, using vitamin C to improve absorption, selenium to activate the detox enzyme, and glycine, which helps fill out glutathione production. And if you're using NAC with other detox agents or antioxidants like ALA, milk thistle, or sulforaphane, be intentional because there are a lot of good ideas out there. So think synergy, not redundancy. NAC plays well with others, but works best with protocols that understand its physiological role as a sulfur donor and a detox substrate, not a standalone hammer. It's also worth noting that for sensitive patients or those with histamine issues, NAC can occasionally provoke side effects if methylation or sulfation is impaired. Always dose accordingly to the patient's tolerance. Another question I get is, can NAC support neurological and cognitive function, especially in patients on anabolic therapy? While this is complex, the short answer is yes, and this is often overlooked as a benefit. NAC crosses the blood-brain barrier and influences glutamate modulation, oxidative stress balance, and even neuroinflammation. Patients on anabolic compounds, especially at supraphysiologic doses, often report irritability, brain fog, and mood instability. These symptoms may reflect neuroinflammatory signaling and disrupt glutathione systems in the brain. NAC helps restore that balance. Think of it this way. When someone uses anabolic compounds, especially at high doses, the brain gets overstimulated and inflamed. This often shows up as mood swings, brain fog, or poor sleep. NAC works behind the scene to calm the storm. It helps your brain kind of clear out the waste, balance more of the chemicals that affect mood, and protect against any kind of stress that wears down the mental sharpness. It's like giving your brain a reset button, helping it function smoother and more clearly, especially when it's under the extra load of hormone and anabolic use. While it's not a psychiatric medication, it does support neuron health through multiple mechanisms. I've seen it improved in mood stability, mental health clarity, and even sleep quality when NAC is used in the right context. It's not going to override strong psychoactive effects of some compounds, but it helps support the neuroendocrine pathways. NAC is a long game molecule. Some patients feel the benefits within a week, like improved recovery or thinking clearer, but the deeper metabolic and detox effect typically emerges around 4 to 8 weeks after consistent use. That's why it's critical to frame NAC as a foundational agent. It doesn't override physiology, it supports it. And that takes time. Patients should be educated on this upfront. They may not feel it kick in like a stimulant or a hormone, but over time, the downstream effects are powerful, especially when it comes to supporting liver function, inflammatory resilience, and hormone clearance. Consistency, proper dosing, and synergy with other nutrients are what drives the outcome of NAC. NAC isn't a hormone. It's not a medication. It's a nutraceutical compound, a supplement that works as a tool. That tool works within the body's own physiology to support detoxification, redox balance, and liver metabolism over time. Unlike pharmaceuticals, it doesn't override the system. It reinforces them. And when used consistently, NAC becomes a cornerstone for long-term support, not a quick fix, but a quick strategic ally in restoring functional capacity. And it's not a one-pill solution. It's especially valuable in the context of hormone use, anabolic support, or performance medicine protocols, where oxidative load is very high and clearance of the pathways are stressed. But I'm going to be clear, NAC is not going to fix someone's lab overnight. It's a supportive agent that helps restore optimal function over time by boosting the body's own adaptive systems. It's about creating a long-term strategy focusing on biochemistry, not just symptom chasing. And if you're building protocols rooted in longevity, hormone therapy, or performance medicine, NAC deserves serious consideration. For more clinical insight like this, where biochemistry meets practice, stick around. And if you've used NAC in your protocols and seen results, drop a comment and let's share ideas. Stay grounded, stay curious, and I'll see you in the next one.